Gout is a buildup of urine acid that turns into crystals in the joints and causes pain and inflammation, also known as acute gout attacks. Uric acid is a waste product after the body breaks down substances called purines, which are normally produced in the body and are also found in foods and drinks. Gout can lead to arthritis in affected joints. Risk factors. Gout is usually caused by either overproduction or underexcretion of uric acids. For example, genetic predisposition and consumption of high purine foods can lead to excess uric acid levels. High purine foods include meats, seafood, and alcohol. Memorize the food list for the NCLEX. Dehydration can lead to decreased excretion of uric acids and cause gout. Obesity is also a risk factor for gout due to a certain type of fat called visceral fat that can cause inflammation and trigger the onset of gout. Signs and symptoms. The big toes are the most susceptible joint for gout attacks. It is because uric acid is more prone to turn into crystal in cooler temperature, and big toes are the furthest site away from the heart. But gout can also affect elbows, wrists, knees, and ankles. The affected site will appear red, warm, and painful. Diagnosis. Uric acid level will be elevated, of more than 6.8 milligrams per deciliter. X-ray or CT scan can also help with diagnosis. Nursing interventions. There is no cure for gout, and the goal is to prevent acute gout attacks. Colchicine is FDA approved for treatment of acute gout attacks. Colchicine inhibits activities of neutrophils that are associated with mediating gout symptoms, and therefore reduces inflammation and swelling. The most common side effects are GI upset such as nausea and diarrhea. Avoid taking with grapefruit juice as it increases the concentration of the medication. NSAIDs are usually prescribed along with colchicine to reduce pain associated with the inflammation. Probenecid and Allopurinol are given to prevent acute gout flares in those with chronic gout. Probenecid promotes renal excretion of uric acid and prevents hyperuricemia or high levels of uric acid in the blood. Side effects include GI upset and renal calculi or kidney stones. Allopurinol inhibits the production of uric acid to prevent hyperuricemia and gout attacks. Allopurinol takes weeks to start working and can also cause GI upset, kidney stones, and hepatotoxicity or liver toxicity. Allopurinol can also cause an adverse reaction called Stevens-Johnson syndrome, which is a potentially fatal skin reaction characterized by painful rash and blisters. Please watch my separate video on Stevens-Johnson syndrome. That's why it is very important to educate patients to report any rashes to the provider. So in summary, colchicine and NSAIDs are used to treat acute gout attacks, and Probenecid and Allopurinol are used to prevent gout attacks. On top of that, educate patients to increase fluid intake of at least 2 to 3 liters a day, unless contraindicated to flush out the uric acids and prevent kidney stones, which is a side effect of the medications. Avoid high purine foods such as meat, seafood, or any form of alcohol. Lose weight if obesity is one of the risk factors for the patients. Report to the provider immediately if rash develops while on allopurinol.